Hi everyone, this is Ginger here. I'm back for part 3 of our 3-part series on breaking down resetting your nervous system. And I do that in part, there are many ways that we can do that. I do that through something called the NAP, N-A-P, right? Napping. N stands for a neutral voice box larynx here. A stands for a good shape of the diaphragm, which is called apposition. And you can seek out some of my other videos on YouTube or my reels on Instagram that will demonstrate and show you more about that, including ultrasound imaging that I do in my clinic. The third is, and that's where we are today, is P, pitching. What does that mean? It means the choice of whether or not we make sound or subsound in order to manage stress. Now, not only does it help you manage stress, but it improves your vocal quality. You don't have as many cracks and pops and kind of that growling sound of the voice. The voice doesn't sound as weak or tired. As you notice, as if someone ages, the voice tends to sound less strong, right? There's less projection. And there's more of those cracks and pops. So this will also help with that. And if you're a singer, like I am, you need this stuff. You gotta have it, you can't skip it. And if you're a pelvic floor PT or pelvic health PT, or if you're just a person with a pelvis, it will help your pelvic health, right? So pitch, we have 2 options. And this is all about resetting your nervous system. But again, it's about helping the voice and the pelvic floor too. All right, so for pitching, I want you to drop into a place, and I'm just sitting here. It's nothing special. I don't need my yoga mat, right? This is my office. Just sitting here in my office. And I want you to think about getting the breath in as clearly as possible, meaning imagine your airway going straight down into your lungs, right? They kind of branch out like this. How's the easiest way to get air into the lungs? Probably not by us doing this, though you can do that. If you really have a hard time feeling this expansion back here in the ribs, I want you to put your hands here, and you might want to just sit up a little bit more and belly dance or swim. I also like to call it swimming the pelvis around until you can feel, and you can probably see a little bit. See my ribcage expand? But it's not chest heaving. It's just ribcage expansion. This is not a skill you learn overnight. It's something that you deliberately practice. And this is my charge to you, is practice this every day, especially when you're in pain or feeling stressed. Ribcage expansion and belly expansion. Not chest heaving, not chest rising, not tightening here. Once you feel like you have the hang of that, stop the video if you need to practice some more. Once you feel like you have the hang of it, I want you to take an inhale into your back ribs and hum it out with me. Really light, really easy, really breathy. Make it as light as you want. Keep going as long as you can. Until you run out of air and the sound becomes a whisper. If you have vocal problems now, I want you to lighten it up, lighten the load. We want to unload the voice and the pelvic floor with this. And on our exhalation, we're going to do something called sub-phonation, and it sounds like this. Inhale, ribcage. No chest breathing. And see my waist come in as I do that? Do it with me again. Literally just put your hands on yourself, right? Exhale. As long as you can go, as long as you can go, as long as you can go. Keep going, keep going, keep going. As long as you're talking, you're still exhaling, right? that immediately flips the vagus switch from feeling frazzled and overwhelmed to taking the next step in front of you. And believe me, I have experienced, I'm there with you. My life is not stress-free, right? So I share this stuff with you because I practice it. It works for me. I can show you in the literature where it works. But we need to have it broken down into tiny little pieces that make more sense for us. Instead of someone just saying, oh, just go do some yoga and breathe. It'll be fine. Or just throwing out at you, oh yeah, just try this ujjayi thing. It'll change your life. Well, why and how? And how much do I do it? So this is just as simple as it can be. Inhale, no chest breathing. I want you to breathe into the belly and in the ribs. Below the sound of the voice, go like a waterfall, like the ocean, right? All the way out. Keep going, keep going, keep going, keep going. Your pelvic floor lifts as you do this. I'm still exhaling. Take one more time. Last time, you can just keep doing this over and over, but really, how frequently do you need to do it? Just a minute or two. It really doesn't take a lot of effort. Last time. Exhale out like a waterfall again. Exhale, exhale, exhale. Even if it's like this. Right? It is like you're blowing through. If you're an instrumentalist, you'll know exactly what I'm talking about. I was trained classically in flute. You're not just spitting out all the breath at one time, right? You're not just dumping out the water all at one time. You're blowing across that instrument, through the harmonica, across the flute, into your saxophone, whatever it is, gradually, 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 right? If your lungs are a glass of water, you're just barely letting the air come out a little bit at a time. It is transformational. And it is the key to everything good about finding a really good vocal quality, really healthy pelvic floor, really good breathing. So if you suffer from allergies or just anxiety, stress, or digestion issues, this is the key, is the nap. Now I have lots of videos about the nap on my YouTube channel. You can go and watch more of those. Today was just the pitching part. And you don't even have to pitch. Pitching meaning sound. You don't even have to make a sound. You don't have to go or although as you progress, and if you study with me at all, we work into bigger ranges and more sounds and even better vocal quality. But you can just start with the ha sound to get you started. I hope this has been helpful, you guys. The reason I do all of this is because there's too many people that go into their doctor's office or their therapist's office or whatever it is, and they're not listened to. They are kind of medically gaslighted. It's a thing. That means their story's not listened to, they're not taken seriously, they have a serious condition that turns into something much worse because they weren't listened to initially. Not sure what that noise was, but just ignore that. That's why I do this, is to bring you this information directly and know that if you're having stress, pain, anxiety, depression, if you have musculoskeletal pain, if you have voice issues, allergies, digestion problems, pelvic floor problems, these little simple techniques will help you kind of parse out. If it helps, wonderful, right? Then you're changing it, and that puts you back in charge of your health. And if you still continue to have, these issues, that's where you need to seek someone out that will listen. And if you're having trouble finding that healthcare provider who will listen to your whole story and take you seriously, please reach out at my website. And I probably can't personally see you, right? I can't see everyone, but I can point you in the right direction, and I can help you find somebody who will. All right, I'd love it if you give me a subscribe on my YouTube channel. And if you need help, reach out at drgingergarner.com. And if you're looking for more classes like this that are guided, go to my other website, integrativelifestylemed.com. Thanks for listening.